And now we will be discussing the lymphoid tissue tumors. But first, let us clarify. When we say lymphoid tissue tumors, it's not tumors of the lymph nodes. It's more of a tumor due to the lymphocytes or generally the white blood cells. Okay? And again, lymphangioma is a tumor of the lymphatic vessels. Okay? Again, lymphoid tissue tumors are tumors of the lymphocytes or the white blood cells. Okay? And first of the lymphoid tissue tumors is the Hodgkin's lymphoma. Hodgkin's lymphoma is a malignant lymphoproliferative disorder, and current evidences points that Hodgkin's lymphoma has a B lymphocyte origin. It can cause death if appropriate therapy is not instituted or not given to the patient. The clinical features includes the following. The most common initial sites or the most common locations of Hodgkin's lymphoma is at the cervical and supraclavicular nodes, axillary and mediastinal nodes. Overall, it shows a male predilections and has a bimodal age pattern, meaning it occurs on two age range. One peak is observed between 15 to 35 years of age, and another peak is seen after the age of 50. That's why it's called bimodal age pattern. And the very usual presenting sign of Hodgkin's lymphoma are persistent enlargement, and non-tender discrete mass in one lymph node region. Clinically, if it's untreated, Hodgkin's lymphoma will spread to other lymph node groups. So, like for example, if galing siya sa lymph node dito sa may submandibular submandibular, pwede siya, pag hindi naagapan, it can spread to dito sa lymph node dito sa may leg, pababa dito sa may clavicle, and so on and so forth. And minsan, eventually, pag hindi talaga siya naagapan, it can involve the spleen and other lymphatic tissues such as bone, liver, and lungs. The signs and symptoms that you should look for if you suspect Hodgkin's lymphoma, you include weight loss, fever, night sweats, and generalized pruritus or itching, pangangate. Okay? There are two categories of Hodgkin's lymphoma, the category A and the category B. Category A means a patient with Hodgkin's lymphoma that has no systemic signs. And category B includes patients with Hodgkin's lymphoma with no systemic signs. So that's the difference between category A and category B. Okay, so clinically, it will present itself as this one. Sabi ko sa inyo kanina, usually nandito sa may clavicular, sa may cervical. Dito sa may cervical, and supraclavicular area. Yun. Histopathologically, nodular lymphocytes are predominant Hodgkin's lymphoma. Okay? There are 5 subtypes of classic Hodgkin's lymphoma. Okay, these are the following: lymphocyte-rich, nodular sclerosis, mixed cellularity, lymphocyte depletion, and the last one is unclassifiable. I will not discuss further onto this classical Hodgkin's lymphoma subtypes, and so we will be move on to the next slide. In general, Hodgkin's lymphoma will show a diffuse, often mixed infiltrate inflammatory cells that is interspersed with large atypical neoplastic lymphoid cells histopathologically. Meron itong very pathognomonic histologic features. Yun ay yung presence ng Reed-Sternberg cells. This one. And so these red Sternberg cells can be typically binucleated or multinucleated. Kapag binucleated siya, minsan makikita natin yung owl eye appearance or owl eye nuclei. Kapag multinucleated, makikita natin yung penis on the tray. And some people would show popcorn cells. Okay. A konting backgrounder with Hodgkin's lymphoma, no? Yun lang. Hodgkin's lymphoma, moving on pala. Moving on na lang muna tayo. So this is how Hodgkin's lymphoma looks like. Okay? Histopathologically. So ito yung sinasabi ko sa inyo, no? Kapag binucleated, it will show a owl eye appearance. Yan. O di ba mukhang owl, mukhang kwago. Hindi lang isa yan, marami pa. Ito. So isang cell ito na may dalawang nucleus, kaya siya binucleated. So ito, isang cell ito, may dalawang nucleus, binucleated. Actually, parang papunta na siya ng multinucleated kasi parang may magsisimula ditong isa pa. Ito, owl eye appearance din, binucleated. Okay. On a closer look, isang cell ito. Yan. Na merong owl eye nuclei. Dalawa, binucleated. So, pag sinabing red Sternberg cells, isipin nyo lang yung kwago. Okay, kwago. Okay, Reed Sternberg cells. Si Hegwid ni Harry Potter. So the treatment for Hodgkin's lymphoma depends on the category. If it's category A, no systemic conditions associated. And then category B with systemic conditions associated. Local radiation therapy or can be combined radiotherapy and chemotherapy. Okay, so that is Hodgkin's lymphoma. Next, we have non-Hodgkin's lymphoma. Okay, so non-Hodgkin's lymphomas, again, are mostly commonly originated from cells of the B lymphocytes. However, there are studies that shows meron din pala from T lymphocytes, pero very rare na mag-occur ito. The current classification used for lymphomas are from the World Health Organization. This is the current classification, system of classifications. And this system of classification actually is a modified real classification or the modified real classification. It's more of the our European American lymphoma. I forgot the R. Sorry. Okay, so clinically, generally, it occurs primarily in adults. Okay, non-Hodgkin's lymphoma occurs primarily in adults. It develops in lymph nodes, but there are also some extranodal lymphomas. Okay. Nodal presentations of non-Hodgkin's lymphoma will show you non-tender mass slowly enlarging for months. And nodes become more numerous and peaks as malignancy progresses. Okay. So, kaya chinecheck, di ba, yung mga lymph nodes, kung fixed siya or not. Kasi kapag dumami siya, maging fixed, mas malaki yung tendency niya na mag-progress into malignancy. Okay. Again, hindi po tumor ng lymph nodes ang mga lymphoma. It's more of these cells. Just so happen na itong mga cells na to ay makikita po sa lymph nodes. Okay. So, clinical features nito, ganun din. Parang Hodgkin's lymphoma din. Yan. So, in the oral cavity, lesions that are extranodal can occur as non-tender diffuse swellings. The most affected sites, ang pinaka-mas affected na site sa oral cavity ay yung buccal vestibule, posterior hard palate, or gingiva. Okay? And it may show erythematous or purplish color, may be ulcerated or not. Meron mafe-feel si patient na vague pain or discomfort. Minsan akala niya toothache ito. And patient can also feel paresthesia or numb or what we call numb chin syndrome. Okay, so when you hear the term numb chin syndrome, you can think of this is non-Hodgkin's lymphoma. Okay, so this is how non-Hodgkin's lymphoma present itself clinically. So may hard palate, and yan, sa posterior hard palate. Can be ulcerated or can be non-ulcerated. Radiographically, it will present as ill-defined or ragged radiolucency. It will cause expansion of the bone, eventually perforating the cortical plate and producing a soft tissue swelling. Yan. Hindi lang masyadong clear dito, no? Pero yes, nakikita radiographically ang non-Hodgkin's lymphoma. Histopathologically, there is a proliferation of lymphocytic appearing with varying degrees of differentiation. There are two grades. We have low grade and high grade. Low grade kapag well-differentiated yung small lymphocytes. High grade kapag less differentiated yung cells. Remember our discussions with oral squamous cell carcinoma? We have well-differentiated and poor differentiated. So, ganun din. Kapag well-differentiated, yung lymphocyte sa non-Hodgkin's lymphoma, it is low grade. Kapag less differentiated, it is high grade, meaning more malignant siya. All lymphomas grow as infiltrative, broad sheets of relatively uniform neoplastic cells that usually show little or no evidence of lesional tissue necrosis. If a lymphoma arises from the lymph node, ito yung sinasabi ko sa inyo, no? Kaya hindi natin siya makakonsider as tumor of the lymph node kasi nag-occur lang siya doon. It may occur all outside the lymph nodes din. Pero if ever mag-occur ang lymphoma doon sa lymph nodes, makikita nyo histologically na nawala na yung architecture ng lymph node. As in, labo-labo na. Sobrang gulo, sobrang disorganized. Ganun yung nangyayari sa lymph nodes kapag may lymphoma. So this is how non-Hodgkin's lymphoma looks like histopathologically. Okay? Yan, labo-labo. Hindi ko na din i-discuss in depth para hindi kayo malito. So makikita lang natin dito yung mga lymphocytes. Okay? Unlike sa Hodgkin's lymphoma, wala masyado itong pathognomonic feature histopathologically. Okay? The treatment for non-Hodgkin's lymphoma depends on several factors like yung staging, yung grade ng lymphoma, kung low grade ba siya or high grade. And also depends on the overall health ng patients. Okay, kaya maganda din na malaman ninyo kung ano yung mga significant findings sa past medical history ng patients. Chemotherapeutic can also be used as treatment for non-Hodgkin's lymphoma. And some would also opt to do surgical management, which is not actually usually indicated for non-Hodgkin's lymphoma. Okay, so that is Hodgkin's and non-Hodgkin's lymphoma. Next, stop for the next lesion or condition for lymphoid tissue tumors is the Burkitt lymphoma. Burkitt lymphoma was named after Dennis Burkitt, Dr. Dennis Burkitt, who is a missionary doctor. Okay? So nagpunta si Dr. Dennis Burkitt sa Africa at doon yung unang nakita ito. Siya ang unang nakadescribe. And that under ng Burkitt lymphoma, we have the different clinical types. We have the African Burkitt lymphoma, endemic Burkitt lymphoma, sporadic or American Burkitt lymphoma, and immunodeficiency-associated Burkitt lymphoma. Okay? So, bilang nasabi ko na kanina na nagpunta si Dennis Burkitt sa Africa, ibig sabihin, ito yung kauna-unahang type ng Burkitt lymphoma na nakita. Itong African Burkitt lymphoma. So nakita niyo ito ulit sa Sub-Saharan Desert sa Africa. Usually affected yung mga bata disease na ito. And then, nagkaroon ng separate na type ng Burkitt lymphoma na nag-occur sa South America. So, or sa mga areas na may mga malaria. Okay. So, ito yung sa mga bandang Brazil. And this is now what we call the endemic Burkitt lymphoma. Okay. And then, biglang nagkaroon din ng sporadic type ng Burkitt lymphoma. Or, ito yung may mga paglaki ng tiyan sa American. That's why it's called sporadic or American Burkitt lymphoma. And then, nagkaroon nga ng immunodeficiency-associated Burkitt lymphoma nung nagkaroon din ng AIDS o HIV din. Okay? So, yun. And then, meron akong sasabihin. And with regards to African Burkitt lymphoma. Yun. With regards to African Burkitt lymphoma, dito din unang nakita yung Epstein-Barr virus. Epstein-Barr virus. Dito unang na-identify yon. So sabi nila, baka naman may kinalaman itong Epstein-Barr virus sa African Burkitt lymphoma. Okay. Meanwhile, pagdating sa endemic Burkitt lymphoma, sabi nila, baka nga may kinalaman din yung malaria sa pagsulpot ng endemic Burkitt lymphoma. So, yun yung sabi nila. And then lastly, itong immunodeficiency-associated Burkitt lymphoma, sabi ko nga kanina, may kinalaman sa age kasi nung nagkaroon ng AIDS, doon din sumulpot yung immunodeficiency-associated Burkitt lymphoma. Okay, so, ganyan ka-wide or ka-broad ang Burkitt lymphoma. Dalawa lang madidiscuss natin for this lecture. The African Burkitt lymphoma, unahin natin. It usually affects children. A peak age would be 7 years old. And it is located at Sub-Saharan Desert in Central Africa. It has a male predilection. Usually makikita to yung mga paglaki ng jaw, mga panga, posterior segment sa mga African kids. Okay. However, sabi dito, maxilla is involved more often than the mandible. Okay, so lumalaki talaga yung mga mandible ng mga bata with African Burkitt lymphoma. For sporadic Burkitt lymphoma or the American type, greater yung age range niya, hindi lang makikita sa mga bata. And unlike dun sa jaw expansion ng African Burkitt lymphoma, sa sporadic Burkitt lymphoma or American Burkitt lymphoma, paglaki naman ng tiyan yung nakikita. Okay? However, it may also produce facial swelling and proptosis. And can also present with pain, tenderness, and paresthesia. But it's usually minimal. There is also premature exfoliation of deciduous teeth. Okay, so isang red flag na sa inyo yun, parang, bakit nagkakaroon ng premature exfoliation ng deciduous teeth? So better check patients kung may Burkitt lymphoma siya. Okay? There is also enlargement of the gingiva or alveolar process, kasabay ng abdominal enlargement. Okay, so this is clinical features, no? Hindi ako nakakuha nung picture nung jaw at saka ng abdominal. However, intraoral, it may show like this one. Radiographic, it will show destruction of the bone with ragged, ill-defined margins. It can begin as several similar smaller sites, eventually enlarge and coalesce and enlarge. And sometimes, sabi nila, early signs daw ng Burkitt lymphoma, makita nyo yung patchy loss sa laminadura. So, yan. So, Burkitt lymphoma, napapakita din siya na may mga floating ng ngipin. Same with the Langerhans histiocytosis X. Histopathologically, makikita natin dito yung undifferentiated small non-cleaved B cells, lymphoma. It can also shows broad sheets of tumor cells with round nuclei and minimal cytoplasm. However, ang pinaka-pathognomonic feature, histopathologic feature ng Burkitt lymphoma is the classic starry sky appearance. This is because the presence of macrophages within the tumor tissues. So yung mga star na to are actually the macrophages. Okay? And the standard of care, small molecular genetic analysis should be performed. So, ayan. So, starry sky appearance. Sabi nga ni Vincent Van Gogh, starry night. Okay. So, may mga, ayan, yung mga yan ay mga macrophages. On higher magnification, makikita nyo ito. So, these are the starry appearance. Ito yung mga macrophages. Yan. Okay. So, pag sinabing starry sky appearance histopathologically, isa lang ang papasok sa isip nyo. That is Burkitt lymphoma. And the treatment for Burkitt lymphoma, it depends. Rin, kasi this is aggressive. This condition or this lesion is very aggressive. Okay? Usually, a patient with Burkitt lymphoma will die within the 4 to 6 months after diagnosis. Kaya kailangan dito intensive chemotherapeutic regimen to make the life of the patient longer. And the next, lymphoid tissue tumor. Okay? This one is more of the malignancy of the plasma cell origin naman. Kanina, puro B cells, di ba? This is the disease of adults. This is, there's some predilection for men compared to women. The median age for diagnosis of this one is 60 to 70 years old. And it's rarely diagnosed before age of 30. There is a significant bone pain, particularly in the lumbar spine, which is the most characteristic presenting symptoms of multiple myeloma, the pain. There can also be pathologic fractures that can occur in multiple myeloma. And fever may be present, and renal failure, malalaman natin to because presence of Benz-Jones proteins. There is also tongue enlargement and firmness. Okay, around the eyes, makikita din natin na medyo waxy and firm. Merong plaque-like amyloid deposit around the eyes. Okay, so ano nga ba yung Benz-Jones protein? So makikita to sa mga urine analysis ng patient. So kapag nakita natin na may Benz-Jones proteins yung result dun sa ihi ng patient, oy, red flag to. Pwedeng may multiple myeloma si patient. Diba? Radiographically, multiple myeloma will show a multiple well-defined punch-out radiolucencies. Yan. So, sobrang evident to sa mga skull films. Yan. Makita nyo. Yan o, punch-out. Multiple punch-out. So, si patient, sasabihin natin, meron siyang MM or multiple myeloma. Yan, multiple punch-out. Yan. Okay. Histopathologically, there is a diffuse monotonous sheets of neoplastic variably differentiated plasmacytoid cells that invade and replace the normal host cells. There are also mitotic activity that can be seen. Yung sasabi ko sa inyo kanina, screening of the serum or urine by protein electrophoresis para malaman natin kung may multiple myeloma sa patient. So this is a histopathologic representation of multiple myeloma. Makikita nyo yung mga plasmacytoid cells. Mukha silang mga plasma, no? Pero hindi talaga sila mukha silang mga plasmacytoid cells. The treatment for this one will include chemotherapy, stem cells, bone marrow transplant, and of course, radiation therapy. Okay? So I think this is the last slide for lymphoid tissue tumors, no? And I hope you get short insights, small insights on the lymphoid tissue tumors. Okay. So again, lymphoid tissue tumors is a malignancy of the lymphocytes or the lymphoid cells, not of the lymph nodes. Okay. So thank you for listening.